sometimes people show, and again, if they don't, that's okay, because it's run video. So. Okay, you want to have a seat, sweetheart? Okay, ready? Good evening. Hi, I'm Jennifer Acey. I am the Deputy Mayor here in Bernards Township, and I am excited to welcome you to another program of Understanding Bernards. As many of you know, this program is designed to help residents better understand what the role and scope of local government. And this evening, we are very fortunate to have Lucy Forgione, who is the head of our health department, and some of her esteemed colleagues that will share with us about some of the things that they do in helping our community. So what I'll do is, without further ado, I will turn this over to Lucy and her staff, who will share with us and walk through the many aspects and focuses of the health department. Thank you. And again, thank you, Lucy, and everyone for your presentation.
Well, good evening, everyone, and thank you for the opportunity to present on this first day of summer. The summer solstice is the longest day of the year. I hope our presentation, Understanding Your Public Health Department, it's not just COVID-19, will not be as lengthy, so you can enjoy the rest of the day. Please meet your dedicated, talented, and distinct public health heroes who worked tirelessly for the last 3 years on COVID-19. While many work from home, we reported to the health department every day. We even worked weekends and many, many long hours. As Jennifer said, my name is Lucy Forgione. I'm the health officer for the Bernards Township Health Department, and I absolutely love my job. I love my job so much that I held 2 positions with 4 titles for over 40 years. I held the title of Health Educator, Youth Services Coordinator for 11 years, and loved it so much that I have been your health officer, Director of Health, Register of Vital Statistics, and Youth Services Coordinator, Health Educator for the past 30 years. It is my privilege and honor to serve our beautiful Bernards Township, where I work, live, and have raised 2 sons. So the Bernards Township Health Department is a contractual health agency, and we service 6 communities. Besides Bernards Township, we service Bernardsville Borough, Peapack and Gladstone Borough, Long Hill Township, and Mendon Borough. And that is in 2 different counties, Somerset and Morris counties. Our goal for each of our 6 municipalities remains the same: to provide the best public health services and to protect the health of all our residents and visitors that come within Bernards Township and the remaining communities. I would like to introduce Tricia Cowell, who is our Senior Register Environmental Health Specialist and really my right-hand person, and Michelle Santoro, who's our Animal Control Officer, Humane Law Enforcement Officer, who are with me this evening, that will explain further some of the many services that we provide here in Bernards Township. The additional thing on the slide is just showing that we are a recipient of a national award, and we were so honored that we received this from the National Association of City and County Health Officials as being one of the best health departments, but small. We enjoy excellent audits by the state of New Jersey. As a matter of fact, I have our annual audit here, our annual meeting here, and in it, from 2022, has so many, it's chock full of things that we've accomplished in 2022. But the state auditor actually took one of these copies several years ago and shares it as an example for what other health departments should be doing. I'm very proud of that. Okay, so this is who we are. There's so many different things that we do. But the first thing that I wanted to mention to you, that our oversight at the health department is by a board of health. And this board of health is an autonomous board, and they oversee the work that we do every day. And besides that, we also have the 6 communities that we meet once every 6 months, and we discuss mutual issues and concerns. And it's always very nice to see the boards of health presidents from each of these communities that we've serviced, perhaps for some over 40 years and others for maybe 60 years. And these are our neighbors. So from this organizational chart, you may see that we have a diverse, well-educated, and a resourceful workforce. The majority of the people on this flow chart have either master's degree, bachelor's degree, or holding licenses and certifications. We have 7 full-time people and 9 part-time, which include 4 animal control officers that are part-time. Many of our staff members are cross-trained, and they're cross-trained so that we can help residents at any given time when they come to our counter, and we're always happy to help. But the other thing that I think is interesting is that we are an all-female department. We didn't even notice until someone congratulated us on the International Women's Day in March. We're like, oh, I guess we are. We really never really paid attention or knew. But this organizational chart shows you the many different titles that we hold, from registered environmental health specialist to health educator, public health nutritionist, administrative assistants, animal control officer, just to name a few. These individuals have certifications or registrations or licenses in order to conduct the work that we do. It's not just for anybody, and I think most of us are very, very motivated and dedicated to our life's work. And I see that every day with the people that work with me. In 2021, Bernards Township was a recipient of a grant to temporarily hire some staff members. And that was, I guess, the second year of COVID. We could have used the help a little bit earlier, but that's when we received the money. And for public health, it's really all about the workforce. It's our biggest strength, but it's also our greatest weakness, because once the grants end in 2024, I'm going to be losing 3 people. I'll be losing our public health nurse, also a registered environmental health specialist that does a lot of the restaurants and septics and wells and things of that nature, and also vulnerable populations and our grant manager. And these will all end in July of 2024. So I mentioned the Board of Health. This is a photo of Board of Health, and Jen, thank you so much. I think you've been on the board for over 10 years, something like that. Thank you for now coming back as our liaison to the Township Committee, and you're a tremendous help to us. But under New Jersey law, every municipality must have a local Board of Health, whether advisory or autonomous. In Bernards Township, it's 7 members that are appointed by the Township Committee, and it's autonomous in that it sets policies, it passes ordinances and laws, it sets salaries, it hires people. It is really a wonderful board consisting of varied backgrounds and diverse backgrounds. And we have, like, for instance, a public health nurse. Jennifer AC is from the pharmaceutical company. We have Matt Majewski, who's marketing in the business community. Patricia Crane. Hi, Pat. She's one of our lay advisors. She's lived here her whole life. We have Dr. John Salaki, the gentleman that's standing up in the back of that photo. And Dr. Salaki is our board president, but he's also an infectious control doctor. And he signs all our orders. So whenever we want to buy vaccine or order it, he signs the orders. He also signs the orders on how to administer that particular vaccine. So he acts more than like a medical director for us. And we so appreciate Dr. Salaki. And let's see, we also have a attorney. And why do we have an attorney? Well, because of the laws and the ordinances that we pass. We need to make sure they're all correctly written and correctly passed in conformance of the law. Also, Dr. Salaki, just one last thing is that during COVID, he came in every week to test staff because we were the workforce that needed to stay healthy. We couldn't get sick. There were a lot of people relying on us, so therefore, we would test every week, make sure that none of us were positive, and then we would be able to work. So that's our Board of Health. The mission statement for the Bernards Township Health Department is to provide competent, professional, and efficient public health and environmental services to our residents of our community. It is through the delivery of state-mandated public health practice standards of performance for local boards of health and the ordinances and policies of the Board of Health that we protect the public's health, via health promotion, education, disease prevention, environmental enforcement, and inspection activities. So how do we accomplish the mission statement, and what does the health department do? Well, it's really a misunderstood profession. My 91-year-old mother, for years, as a health educator, thought I was a teacher. For the last 30 years that I've been the health officer, she thought I was a police officer. Well, she wasn't so wrong, because a lot of the work we do is law enforcement, and the majority of our work really is, we're not really heavy-handed. It's all about public education, because we feel and believe that our mantra is compliance through education. So let's start by saying, what do we do, so let's start. So by saying that what we do in public health is complex, challenging, and always changing every day. When we come in through those doors, we don't know what will face us. It could be anything. It can be from a raccoon stuck somewhere that Michelle has to go out on. It could be monkeypox. During COVID, we were also dealing with monkeypox. We were dealing with Ebola, bacterial meningitis, hepatitis A, foodborne outbreaks. It is so interesting and so diverse, the work that we do. And we are almost like, I would equate us to like an insurance policy. For the most part, we keep things quiet, so you don't hear from us that much. You're thinking, what are they doing? But we are behind the scenes. We are monitoring disease. We are making calls. We are really busy all the time. So can you imagine what it was like for the health department during the deadliest pandemic of our time to oversee the health and safety for 6 municipalities in 2 counties consisting of over 60,000 people, and monitoring over 49 schools, preschools, and over 10 long-term care facilities, group homes, and so much more, the general public, right? We are so proud of our work, so proud. And if you look at the slide here, you could see that these slides are all different dates, and they're different dates because testing didn't start right away. The pandemic broke out early, or I should say March of 2020, and by December of 2020, we started testing. We had a company by the name of WellCare that actually tested up until earlier this year, and WellCare tested 5,654 individuals. And as of May 2021, when the first vaccine came out, we've been giving shots, still every week we just gave out shots on Tuesday. To date, we have given out 4,731 vaccines. We have had vaccine and testing 247 clinics. And a big shout out to St. James Church, who has allowed us to leave all our supplies there all these years so that we can just go and set up and have clinics. And it's a great service to us. We really appreciate that. And to the visiting nurses of Atlantic Health and our public health nurse, there are times where the lines were so long, I just can't imagine how their hands felt after giving out so many vaccinations. And also we went to homes, over 131. This week we did a couple more homebound vaccinations. So if you can't get out of your home, the nurse will gladly come to your home and give you a vaccine. The other thing that I wanted to mention, that I don't know if you know this fact, that in January of 1777, George Washington mandated that all troops coming from Philadelphia be inoculated against smallpox. And many people attribute this success of the Continental Army of the United States to having a healthy army. So it's been around for many, many years of vaccines. That is our mission in public health, is to inoculate people, and we did exactly what we were asked to do. The other most important thing that we continue to do even now is COVID weekly updates. And these went out, and when we first started, they were almost every day, and then slowly but surely we didn't have as much of an interest, and it went to like weekly updates. So we've done 106 to date. So on the bottom you can see, I don't know if any of you know Dr. Porter. He's a pediatrician in our area. That's Dr. Porter there with the mask on. and he helped us a lot during COVID. In the middle photo is Dr. Salaki. Early on, before testing was even made public to anyone, we were fortunate enough to have Tim Cutting, who knew someone by the name of Stephen Smith, who was conducting a study, and as a result, we were able to test our workforce here, mainly the police department and people that were first liners that we needed to see if there was COVID present in our community. And the last slide is, we get vaccine delivered. When it comes with people who have badges and who are, their abilities are there to bring us the vaccine. But the vaccine is a lot of work because you have to keep temperatures logs. You have to make sure that everything is properly recorded. We also were audited, and we had to make sure that we had a beautiful audit, which I was very, very proud of Rhea Patel, actually, in our office, who really has taken a great interest in this type of work and making sure that vaccine gets to the location and back safely. So despite fading into the media, from time to time, there's still continued interest in COVID-19, and we get calls. But I think it's safe to say that we're a little tired. But like I've been mentioning, it is our duty to promote and to meet the needs of our community. So let's get started with, what do we do? What are some of the services that are out there that you would all want to know more about? So I happen to be the Registrar of Vital Statistics. And we have 4 of us who are trained and certified to be a registrar. Some are deputies, some are sub-deputies. But what we are is responsible for maintaining and administer records of vital statistics, and the registrar issues marriage licenses by appointment only and provides certified copies of marriage licenses, birth certificates, and death certificates. So with marriage licenses, people come in and they fill out an application. That's not the day you're getting married, because some people do come in with bouquets and they think they're getting married in white dresses, but that's when you come and make your application. And then there's a 72-hour waiting period, and then we issue you a license to get married. If you get married, if you make the application here and get married here, we will hold your license for future use to get certified copies. Now, births. We don't have a hospital here in Bernards Township, so there have been births on 287 in Bernards Township, in people's driveways, in their homes, or they've had special midwives that have had home births. So we would issue a birth certificate for those individuals. We also issue death certificates. The majority of the death certificates that we do issue is through Galloway and Crane, which is our local funeral home, but also issuing certificates for the VA hospital that is in our community. So every month when we look at the numbers, a good portion of them are from the Veterans Administration here in Lyons, excuse me. Okay. So health education. We are certified health education specialists or master certified health education specialists, providing all kinds of educational. Again, I mentioned our motto is compliance through education. We do individual or group sessions. During COVID-19, Dr. Salaki did a Zoom call, Ask the Doctor. So there were so many questions. And so even when we could not do any programs like this in public, we were able to do programs via Zoom, and it was so well attended. In addition, we have had this year wonderful programs like Women in Heart Disease, anti-inflammatory diets. We have nutrition programs at the Bernards Township Library, What's in Your Kitchen, things of that nature that people really love, and they're always giving us suggestions for what else we can do. We also have trained many in health topics. For instance, we received a very small grant to educate workers in kitchens at all the various long-term care facilities. And you never realize, the importance of that, but for instance, hepatitis A is something that that can infect the food source, and many people can get sick. There was something like that happen in Morris County about 4 or 5 years ago that affected over 30 people. We also do community needs assessments. Hospitals, in order for them to get certain funding, they have to do these needs assessments to see what is it, what are each community, what are the health problems that are most prevalent. So we work closely with Robert Wood Johnson St. Barnabas, and we also work with Atlantic Health in Morristown. We develop beautiful educational materials. You might see some of our flyers. We have a monthly newsletter called Health Matters, and we do lots of grant writing. And in the community, we coordinate with many, many different groups to do programs. We have some nutritionists that come and work for us, as well as our own in-house nutritionist. So some other services, clinical services. We contract. Like I said, we are a very small health department, so therefore a lot of things we do not have in-house staff. We contract with the Atlantic visiting nurse, probably 50 years, maybe longer. This was the first time in 2021 that we were able to hire a public health nurse, and it's probably one of the best things that's ever happened to the health department is having our own in-house nurse. She does home visits. She gives flu shots to the homebound. She has done a tremendous outreach with our hard-to-reach population, doing diabetes screening and high blood pressure screenings. We also contract out with the community VNA, and what Child Health Conference means is childhood immunization from birth to age 18, giving vaccines like measles, mumps, rubella, hepatitis B, things of that nature. These clinical staff members also have provided for us H1N1, seasonal flu shots, and COVID-19. And lastly, the skin cancer screening, which is coming up at Fellowship Village. We partner with all our community partners, and they allow us to use their medical facility where we have individual rooms. It's very private, and Dr. Quigley from Memorial Sloan Kettering is there to do a complete head-to-toe exam, and really always finds things and refer people out. So it's a wonderful service. We actually just opened up those appointments now. If you're interested, please call us. Nutrition. This is really the heart of our home. I've always hired nutritionists. When I worked for the city of Newark, we had a nutritionist, and ever since I've been here in Bernards, I've always hired someone, and we have someone in place now that will be doing supermarket tours, partnering with either Stop and Shop or ShopRite, camp programs for Parks and Rec, doing a program, Healthy Eats, Happy Kids, senior wellness programs, Ridge Oak, and other housing. We have CASH up in Chester, MASH, and like MASH would be Mendham area senior housing, where we go in and we'll do a presentation for them. Something like perhaps cooking for one would be something appropriate, or making sure you have enough calcium, or what foods are high in iron that you should be eating, especially for this age group that very much needs it. We do many heart health programs. And then one of our famous programs that I love that Ridge Oak always asks for is Life by Chocolate, because there are certain things in chocolate that are very beneficial to us. One of the most recent programs we did is Building a Healthy Kitchen, which was well attended by over 30 people, which really I wasn't surprised, but I think people have the interest on making sure they have kitchens that have the right types of foods. Lastly is something that I've loved my entire career. I always say the Municipal Alliance is as old as my oldest son, who's 33. And that's when the Municipal Alliance started, through a grant. And we continue to do amazing work with just recently the Twilight Challenge 5K, where we had over 200 runners. And that's our big fundraiser. And it's always well attended. We also have a group of youngsters from Ridge High School called REACH, Ridge Education Action Community Health. And what a testament to the parents here in Bernards Township. These students are absolutely amazing. I'm always so astounded by how they speak, how they know information, how they're willing to be ambassadors to other young people who may be struggling with certain issues, but they're wonderful. And they go to a camp every summer for a week. It's called LMTI, the Lindsay Myers Institute in Blairstown. These two photos show you Charter Day, and the other photo shows the Twilight Challenge, where we've had tables set up for the public to see. Here are some photos. This was just recently, the first Sunday in June, and it was a great day. And we had a band that the singer won a Grammy as a background singer, and so she really did a beautiful job for us. And so they do it more as a community service. We pay them just a little bit, but they're there for us, and we always appreciate it. Thank you for your attention. I'm going to turn it over to Tricia Cowell.
Hello, everyone. I'm going to talk about a couple different things that pertain to the health department with the environmental side of it a little bit more. So the first thing I'm going to talk about is our risk communication and emergency preparedness. So as Lucy mentioned, we do cover 6 towns, so it's 6 plans that we have in place, and every year we have to review them. There are meetings that are held, and we have to just update the public health annex to make sure that there are things in place in case of emergencies. It might pertain to how are we going to distribute medication. It might pertain to what do we do with road closures or some type of other disaster. We've had a couple storms in the past that have really disrupted either power outages or led to long road closures due to all the damage. One of the things we have to be trained in at the health department is one is called NIMS, which is National Incident Management System, and the other one is ICS, which is Incident Command System. And what that means is if you go to a scene, everyone speaks like the same lingo and the same jargon. It's this way all the terms mean the same thing across the board. So this way everybody's on the same page from the moment you arrive. Because what they learned years ago is different departments use different terms and they didn't mean the same thing. So anyone who's new to the health department has to take them. We've had them, well, I've been here 20 years. I had to do it when I first started. So, and it's very informative and it's very helpful. Some of the other things we do with the risk communication side and emergency preparedness is help with shelters, either help with staffing or help getting them open. We work with either the doctors or the nurses that are there. We work with the area places of worships, either trying to find like food donations or how they can help. A lot of them have kitchens that can be used or even bathrooms that can be used. We participate in drills and activities. Usually once a year, a drill has to be done in each of the towns that we have to be a part of and that we sign off on. They get state funding that way. And we try to really just build relationships and partnerships with all the different towns, with whether it's the administration that's there, the Board of Health that's there, the police, the fire departments, again, places of worship. So this way, they have contact with us, we have contact with them, they know who to reach out to, and we know who to reach out to. We also have information on our website about planning even just a home emergency, a go bag or what to do in case of a fire, and that is information that we do have on our website. Another side is also disease surveillance. So there's a program called Communicable Disease Reporting Surveillance System, and these are reportable diseases, and every day they get populated by either labs, doctors' offices, hospitals, and we have to check it daily to see if there's anything in our towns that requires attention. It could be something like the flu, it could be the chickenpox, it could be outbreaks at long-term care facilities or at daycare centers. And if that's the case, we then need to track them for 21 days. We get the county epidemiologists involved, and we start a line list. And it's just to track, to make sure, and we try to contain. We find the solution. What can we do better? And during COVID, you can imagine we had many going on at the same time, and it was very challenging. We also have to check for childhood lead, any elevated levels. If it's 5 to 9, a public health nurse is involved. Once it's over 10, we actually need to go out and do an investigation and inspection with dust wipes and an XRF meter to determine the source. So it's encompassing, as you can see. We also follow the other illnesses that are listed up here. Childhood immunizations. Every year, the schools, whether it's school, a daycare center, or a child care center, they have to report all their immunizations, and the public health nurses go through it to make sure all the children present have everything that they need. If there's something missing, that person's contacted so they can catch up. Another aspect is the environmental health. There are currently 4 licensed registered environmental health specialists. These are some of the activities that we do daily, whether it's soil logs, septic systems, well inspections, plan reviews, inspections for kennels or body art, public recreational bathing, and public health complaints. So we also issue permits for the towns that we cover in Somerset County. We provide education. That's our main goal. We will issue violations if need be, if things aren't being followed, if there's a threat, a danger, or something like that. We review plans for all of these types of establishments. For a septic system, it's about 5 to 7 visits that we're there, and at the end we send a folder called an as-built to the homeowner, basically of the care and keeping of your septic system, the do's and the don'ts. With wells, we make sure they install enough casing, and we track the well water results when they come in to make sure it's safe. Food inspections we do once a year, schools we do twice a year. Those that may receive a conditional rating, we will inspect 2 times a year. With public bathing, we make sure all the pools are ready to go before Memorial Day, and that's a hectic time for us. So as you can see, there's lots of different activities. We also do some complaints. I think I glossed over that, but we get complaints from garbage, from rodents to mosquitoes, foodborne illnesses, waterborne illnesses, and we have to follow up on all of those. So our key challenges are keeping current with state regulation and codes. The state regulations and code change. Sometimes they're adopted without any changes. Emergency situations, we also stay present and up to date with different trainings that are available. There's now a lot more free webinars that are available that we attend, which is great because we're able to get it done and over with quickly. Any type of emergency situation, again, it could be fire, it could be weather, it could be a communicable disease, power outages. I've been out on 287 in the middle of the night for an overturned tractor trailer or 2. A lot of them are food cargo, and we have to embargo the food and track it and make sure it goes to a certain destination and that the food is basically destroyed. And again, serving the 6 towns can be challenging at times, but it's certainly something we all love to do. And we're out there all weather. It doesn't matter how cold it is, how hot it is, if it's raining, whatever the case is, if there are inspections to be done, we get the job done. I'm going to turn it over to our Animal Control Officer, Michelle Santoro.
Hi, everyone. Animal control. Let's be interactive as possible. You can ask me questions as we go. I'm honored to be here tonight. Thank you for inviting me. I hope this brings some light as to what am I doing and who am I? So my name is Michelle Santoro. I hold 2 titles here for Bernards Township. I'm not only the Animal Control Officer, but I'm also the appointed Humane Law Enforcement Officer. What's the difference? Animal control really would be things like loose dogs, rabies control. We'll get into that. The Humane Law Enforcement Officer really, I think when I leave one day, it will just really go to the police. There were some changes back when Christie was in charge of New Jersey, and SPCA no longer exists. So I have that role in this town that we'll go over. I've been here 12 years. I do have a bachelor's in science and wildlife biology. So this job will also encompass wildlife. Anytime anybody has any questions regarding that, call me anytime. I'm happy to help. Okay, so what is animal control and why would you call me? So I'm under the purview of the health department, mainly because of rabies. That's something that at one time in history, it was an epidemic within the United States. And so if you look back and you see the old pictures of what used to be dog catchers, right? People walking around and they would catch the dogs because rabies was a real problem that then was in contact with people. So that's part of my job. When I get a call that someone has been bitten, we will investigate, the dog, what really happened. Let's do at least a quarantine period that is mandated by New Jersey State. And if it needs to be looked into further, there are laws on the books that will cover such things as potentially dangerous dog or vicious dog, that sometimes we have to get involved and try to correct the issue or have them follow New Jersey regulations as how are they going to keep this dog moving forward. Exposures to wildlife. Well, what is that? Sometimes it happens when someone is in direct contact with a wild animal. Most of the time, it's when, honestly, someone's dog gets in contact with a wild animal that just so happens to be in their backyard. So the wild animal will need to be tested. Usually it's your groundhog that is under someone's shed that has a family, and it's just, the natural instinct of the dog, or it could be a family of raccoons that is digging in the garbage that you left out and your dog is now in contact with them. So you would contact us with that. We will try our best to get the specimen if we can, the specimen being the wild animal, send it for testing, and then do a quarantine period with your pet, because really that not only safeguards the safety of your family, but also the community. As an example, this will be interesting to see how this turns out, but there's a current case in town where an individual just adopted 2 puppies. The 2 puppies were not old enough to have a rabies vaccination. And just because an animal does have a rabies vaccination, you have to have 30 days before the antibodies build up enough in order to protect that animal. So here we had 2 puppies that came in contact with a groundhog, but the groundhog left. So now we're in a situation where they had to then get their rabies shots, but now it becomes a whole can of worms that open up as far as quarantine periods. So I'm kind of leading into my next point, that why is it so important to have your animals up to date with rabies? Even if it's just selfish, it keeps the quarantine periods down, and before you know it, your pets will be going to the dog park freely, not in quarantine, sitting at home. Bernards Township is great as far as we hold 2 free rabies clinics a year. It's always on the 2nd Saturday in November and January. So I urge everyone to certainly take advantage of that benefit. Okay, let's get into pet licensing. I realize that this is something that nobody wants to do, and I get it. It's actually one of the most frustrating parts of my job, but on record, just know that I'm the middleman. I have to follow what the state requires. So besides that it's the law and that we have to, what are some of the benefits to licensing? Well, the first thing is it's a free ride home. So if the tag is on your pet, either myself will bring the dog or the cat right back home, or the police will. They have access to my licensing program. Prompt medical attention. Well, what does that mean? Well, if there's not identification on a dog, and a dog, let's say, gets hit by a car, this has happened, more so than not, who makes the decision on what type of care to provide for this animal? So ultimately, it will be my decision, which I don't like to make. My decision might be different than the owner. So if a tag is worn on the collar, just know, and if, God forbid something happened to your pet, we're going to call you to make a decision for your animal. So that's another benefit. Obvious that lost dogs can't call home, so there's no better place for a dog to be home. They don't want to be in a kennel. They don't want to be in a shelter. They want to be home in their bed. Rabies prevention, we went over that, but it really does help not only public safety to make sure that they're up to date with their rabies, but it also helps when it comes to if there is an incident, you're going to have the minimum amount of time for quarantine. So just keep that in mind as far as something that would benefit you. Lastly, in Bernards Township, pet licensing does go to our homeless pets. This is partially how we're funded, anywhere from the medical, veterinary requirements. Sometimes, the animals that come into our possession that are strays or just need help, that's how we're able to pay for it. It also pays for the kennel costs and any supplies that's just needed. Education. I can't express enough that it's probably the most valuable tool that I personally use. I've had to learn through the years that I think understanding wildlife and domestic animal behavior and what really to do, I kind of just came into the job 12 years ago thinking, well, everybody knows. I mean, I don't, and I realize that's not the case. I think it's almost something foreign at times, especially with wildlife. So I've had to learn to really take things slow and really sit down with people that have wildlife concerns or just not understanding what's in their backyard. And when you do that, you're going to have long-term solutions instead of just a quick reply that maybe they fully still don't understand, but then ultimately it didn't solve the problem because they're just going to call again or they're still going to be concerned. And yet, at the end of the day, you really should just be able to enjoy nature without fear. So once you understand things, that will be alleviated. So I do welcome anybody to call me, make an appointment. I have sat down with a lot of people. We can have like a cup of coffee, some tea. I'll go over any wildlife concerns, any questions, or just proper pet care. There's a lot of people that maybe get that first pet and they realize they're overwhelmed. Animal rescue. As you can see in the picture, these are just some pictures I happen to have left. The fox was a memorable one. He came in through the sewer and got himself caught with his neck, so he was hanging. And you will see a bottle of olive oil. That's one of my secrets, because it's all natural. They can lick themselves clean. But so you see me with my gloves. I'm grabbing my olive oil, lubing it up, and now I'm going to massage it in his neck. And that's really what I had to do as I slid him to the opening to the right, and he ran off. So he was fine. The deer, he got himself in a pickle there. I do have animals that, this is not the first time, but get themselves caught up in soccer nets. So he was a big boy. I did have the police help me a little bit. We put a towel around his eyes, which typically calms down a lot of mammals. And then that way I was able to work and cut the net from his antlers. The cute raccoon picture, that was a juvenile raccoon. He got himself in some trouble just being juvenile. And that went back to olive oil. I had to lube him up and get him out of there. He was stuck. I've also learned, just real quick, that what saves me in this job is knowledge in behavior. I think it saves me, and it also gives me the courage where I don't fear the animals whatsoever. And I think it's just because I know what their defenses are. So for each call I go in, I ask myself, what's the situation? What's that animal's defenses? And I think that's why I prefer wildlife versus domestic. Domestic can be a little iffy at times, little mixed messages. But wildlife will always let you know what their first line of defense is going to be. So I feel like that's really helped me not become injured on the job. The next slide, if anyone is sensitive, I don't want you to look up. This is where my humane law enforcement officer appointed position comes into play. And so it might be a little sensitive, but this is the real world, and sometimes I'm asked, how do you deal with it? And the truth is you don't. The truth is it's something that always stays with you. So if you prefer not to see the slides, but these are just small examples of what really happens even in a great town like Bernards Township. So my job also is investigate any animal complaints. So even if something doesn't feel right, just give me a call. You could be anonymous. I will always go on anonymous tips. I don't want anyone to have the fear that they're going to get caught up in something that they might be fearful of, like whether a court case. So sometimes they have been anonymous tips, and it has led to things. And as a community, I count on you guys to call me. I don't know unless someone calls. As far as education, sometimes I'm able just to educate someone who is not in compliance with the requirements that are set forth in New Jersey State. And that way we're able to remediate a violation if possible. That's really your best bet, if it's possible. These slides, that was not possible. Sometimes when things get to a certain level, you're unable to do that. It's just enforcement. So these are some cases that we had. Again, these are just neglect cases. Someone saw that it didn't look right, and they were right. It wasn't right at all. We were able to take custody of these animals, and we were able to do the right thing. We were able to go to court. We were able to remove that animal from the property, and with the money again, get them the help they needed. Lastly, as far as the animal cruelty side, this was a case recently where even if you see an animal that maybe its fur just doesn't look right, what happens is that's neglect. This was a severe case of matting. The issue is what happens is underneath the mats you're going to have infection, which then leads to major problems. So this was actually a dump situation that the animal is not cared for, but you can see the after. And I kind of just, it's like a good feeling that this dog was adopted by someone in Bernards Township and is completely loved and spoiled. And so you look at before and after, and that's kind of the part that gets you through some of the sadness to say, okay, well, at least we made a difference for this animal. Okay, I would like to end on super positive stuff now. We got through that. Well, how do we get these animals? You know, first thing is, I just want to do a plug to say, please, please, please spay and neuter your pet. I'm sure for those that have watched Bob Barker, you know, he was, every time, you know, you should get it by now, but that's why you're going to see kittens. That's just because someone just didn't, you know, spay the mother. As you can see, I do try to provide kitten therapy for everybody at the health department when we can, and it really does brighten our day, because who doesn't love a kitten? I do try to pawn them off on everybody at the health department. I want to say I have 50%. Everybody at the health department has adopted from me, so, you know. The white dog, that was a recent one this year. He was a dump, and he's now adopted into a loving family. And then the little puppy, the pity puppy, she took my heart. I couldn't take her. I already have my hands full, but wonderful, wonderful puppy that is now living at a farm. Please microchip and license your dog. If any of these animals, as far as the dogs that are showcased, had microchips, we would have been able to return them home. You know, what does my heart say? Yes, they were dumps. That happens. Bernards Township is a corridor, unfortunately, between major highways, so it's not unusual to have dumps. But I would like to believe that, you know, some of these dogs, if they had the microchip at least, we can reunite them to the home they belong to. You know, someone's missing them. Donations. This is how, again, besides licensing, we're able to fund animal control, which is very expensive. The major part, I would say, is the veterinary costs. But I also would like to mention that we work with Basking Ridge Animal Hospital, since they are the one in town, and they have been wonderful. I've worked with them for 12 years since I started, and Dr. Hollow does donate a lot of his services to us. So although there's one side where it's expensive, the other side is, I do give him my sad eyes at times, and he, you know, says, okay, Michelle. Community support. I honestly could not do this job without our community. One person cannot handle this job. So I would like to thank everybody that has ever helped me through the 12 years. Whether you're sending me a donation, whether you're calling me and just giving me, Michelle, thank you, because I might be having a bad day. We appreciate you. Whether it's donating some supplies to say, you know what, I saw that you have some kittens, and I'm just dropping off some food and some kitten toys, because, we want these cats, while they're sitting in a kennel, waiting to be adopted, to have something to do. So again, I want to thank everyone. And lastly, for everybody on the record that has adopted from Bernards Township, I realize there's competitors, right? You have St. Hubert, you have 1,000 different places you can adopt. So I do want to thank every person in this community that has ever adopted from us and trusted me that I was giving them a great pet. That's it. Call me anytime.
This is our newsletter for you all to sign up if you haven't already. And it's a monthly newsletter. And then our website, everything is on the website. So much information regarding our services. And always feel free to call us if you would like any information. So bernardshealth.org. Any questions?
So, commend you. As your team did a very good job during the pandemic. I saw the numbers on a weekly basis, relative to other towns, monitoring them, and I thought you all did an exceptional job coordinating with other centers. The question I had for you is, one question and one request. How do you manage for Lyme's disease, given the fairly rural sections of the town and the tick transmission and the alerts for that? And then I'll leave. My comment is, would it be possible to go back to those alerts that you had during the pandemic era? Because I don't think enough people know about what you all do. Where you let the whole community, they sort of have to opt out of something. So they receive updates, whether they're monthly updates, not too annoying, but monthly updates on what you do. I just wonder if that's a thought.
Okay. So your first question has to do with Lyme disease. Lyme disease is a very tough topic to get statistics on because of the fact that you have to, the way it's diagnosed and the way it's entered into our communicable disease registry. So the only place that has any statistics is the state health department. We no longer follow up with doctors. We no longer follow cases or anything of that nature. It goes all to the state health department. What we do in our office is provide a lot of education. And right now, I have 2 team members that are working on doing educational programs, tick cards, identifying, how to detect a tick, how to remove a tick, things of that nature. And to your second point, you were referring to the fact that the weekly updates were really helpful to you. What we're doing right now is updates in our Health Matters newsletter once a month. Was there anything specifically that you were looking for?
Does everybody get Health Matters in town?
Health Matters, Health Matters, we had it through the RAVE system. At one time, you could actually go in and get that, yes. And now we're reevaluating it because we're finding that I don't think as many people are getting it because we're not sending it out. Like, we send it out electronically, but it's to a smaller population. But we are addressing that because during COVID, we got everyone, basically.
Exactly.
Yes.
So why not use that distribution once a month?
Yes, if we were promised that we could, so now I think what we have to do is revisit it and see how well we could do with that again, because it's a little specific in terms of some people want it, some people don't want it, but they need to sign up for it or opt out. So we will do that because we put a lot of time and effort into these newsletters that, the information, like this month, it's all about, snakes and, of mosquito control radon. We have free kits of radon
Well,
available.
right. So for the season ahead of mosquitoes,
Mhm.
a month ahead, this is what you should expect.
Mhm.
These are the precautions you take. So the month of,
Okay.
then you know what to do.
Thank
So
you. Yeah,
it's
appreciate
all-
that.
yeah,
I
yeah.
agree with you 100%.
Everyone should get it.
Yes.
So
Okay, we will address that further, but
it's
because
very,
we
very
have
useful-
been
very
finding
useful.
this
I find it
too.
very useful, so I just wondered, I think more people would benefit.
Yes, thank you, appreciate that. Any other questions?
Regarding the kennel and our homeless pets, you mentioned donations. Is there a website or a way for individuals to make monetary donations, or is it strictly like fee for the animals?
Do you want to get up, Michelle, and repeat the question?
So I do have a donation box that's at the health department, or a lot of individuals will just mail a check and they'll earmark it under memo, you know, animals for the animal care, you know, donation. I also noticed through the years that they will include an extra check or donation during licensing. So, January, February, March is where my budget tends to continue to go up, you know, and then we'll see what the year brings as far as what I can do with that money. Yeah, thank you.
I have one more question, permission.
Sure.
So, sorry, so I'm a part of the local Bernards group on Facebook, and I've often been, like, I've often seen posts which ask, oh, there's a dead fawn in my backyard, what do I do about it? And so I think people really don't know if they have dead animals, what do they do? So,
Yeah, unfortunately, you know, animals pass for various reasons. If it's on your property, the truth is, depending how your property's set up, let's say you have some acreage, you know, you're in the woods, you can either let that animal, let nature take its course, whether it's through the scavengers that, you know, I'm glad that we have, your possums and your turkey vultures, that kind of thing that will clean it up. Or you can choose to, if, you know, someone's comfortable, maybe put some gloves on, maybe a shovel, put it in a bag, you know, tie the bag and then just throw it away. If it's, and just to get with the deer though, that is a service that most of the time, 99.9% of the time, it's that a deer has been hit by a car. And then a lot of times, you know, they're adrenaline, they just run. And they'll pass away on someone's property. So the police will set that up through a service that is able and has the capability of picking up such a large mammal from the property and disposing of it properly. Yes.
I'm sorry, she's, okay, just try.
Do you have any other questions?
My question, comments. John Gray, longtime resident. Just want to thank the health department. They've always been very good with cranes. The whole township should be very proud of the health department.
Well, thank you, John. And I appreciate you allowing your lovely wife to be without you for an
I
evening.
don't allow anything.
Pat
I don't
Klein,
allow anything.
who's on our Board of Health, really appreciate it. And thank you for this opportunity, Jen AC, for, you know, having these programs and having us here so we could share what we do with the public, because no matter what, how many times we say it, there's many times where we're just misunderstood, and it's an opportunity for us. Tricia or Michelle, do you have anything you would like to add?
Anybody can call me anytime.
Thank you, and good night.
I just want to, before closing, I want to acknowledge and thank Lucy, Tricia, and Michelle. When I joined the Board of Health, and it was by serendipity, you didn't mention, she goes to all kinds of things. I first met her at National Night Out. And my daughter, I had her in a front pack in a baby Bjorn, and she happened to have a vacancy, and as a pharmacist, it was like a perfect match. She's been very thoughtful about her board. As she mentioned, some of the background, she has a vet, you know, she has another physician. So just really, really fortunate. And when I first joined, the activities, the traditional activities, were some of the things that you heard, right? it's so important. They help protect us with all the food inspections, with the pools, all the communicable diseases. And Michelle, all you have to do is look on these monthly reports what this woman takes care of. Any creature, I mean, turtles, it's just, she has such a heart, and we are so grateful to have all of these folks and the staff that is in here. So I'm really grateful to try to sort of more debut. That's why these programs are so important, so people understand what's happening and what resources that we have. I'm a huge fan of the free licensing. Those rabies, by the way, are often 3 years, so it's not like just a 1 year, so that'll save you some money, and they're fabulous. The people that do it are vets that are doing it, so it's not like, you know, some high school kid or whatever. It's all legit and on the up and up. The other little thing, if I can just share a fun little plug about the microchipping, I learned that the most recent microchips, not only are they about animal identification, but they can also tell a temperature. So a recent rescue that we adopted had one of those, and the poor animal doesn't have to have a rectal temperature. They can just scan the chip. So that's for the most recent ones, for whatever that is. So that your animals will also appreciate chipping for however that is. So again, thank you to each and every one of you. I'm excited to see how many hits we get on when this is posted, and I hope that you all find it valuable. And please leverage the amazing expertise that our Board of Health has, or excuse me, not the Board of Health, the Department of Health, and all of the members of it. So thank you so much.
Thank you.
Have a good evening. Lucy also brought, if you want, these